Norditropin Flex Pro 30 milligram 3 milliliter instruction video. How to use a Norditropin Flex Pro pen. Hello and welcome to this instruction video, which will guide you through safe and correct use of a Norditropin Flex Pro pen. First, remember to carefully read the instructions for use that came with a Norditropin Flex Pro. Don't share your pen or needles with anyone else. You may give an infection to them or get an infection from them. If you are blind or have poor eyesight and cannot read the dose counter on the pen, do not use the pen without help. Get help from a person with good eyesight who is trained to use the pen. Don't use the pen without proper training from your healthcare professional. Make sure that you are confident in making an injection with a pen before you start your treatment. You can always refresh your training by watching this training video again. For further information, you can call Novo Nordisk at 1-888-668-6444. Now it's time for you to get to know more about your pen. This is the pen cap, the pen scale, the pen window where you can see the Norditropin. And this is a dose counter, the dose pointer, the dose selector, and the dose button. We will learn more about each of these parts as we move through this instruction video. The needle has 4 pieces: the outer needle cap, inner needle cap, the needle, and the paper tab. Now you know the basics of your pen. Next, we will review the 5 steps you will need to complete your injection. Let's begin with looking at how you prepare your pen for an injection. Step 1. Prepare your Norditropin Flex Pro pen. There are some things you need to do and pay attention to before you're ready to make an injection. First, wash your hands with soap and water. Check the name, strength, and colored label on your pen to make sure that it contains Norditropin in the right strength. And pull off the pen cap and turn the pen upside down once or twice to check that the Norditropin in your pen is clear and colorless. If the Norditropin looks cloudy, don't use the pen. When you are ready to inject, take a new disposable needle and tear off the paper tab. Always use a new needle for each injection. This reduces the risk of contamination, infection, leakage of Norditropin, and blocked needles leading to inaccurate dosing. Never use a bent or damaged needle. Push the needle straight onto the pen and turn it until it's on tight. Pull off the outer needle cap and dispose of it. Pull off the inner needle cap and dispose of it. A drop of Norditropin may appear at the needle tip. This is normal, but you must still check the Norditropin flow with each new pen. Step 2. Check the Norditropin flow with each new pen. If your pen is already in use, you can skip this step. Before using a new pen, check the Norditropin flow to make sure the growth hormone can flow through the pen and needle. To check the flow, turn the dose selector 1 tick mark to select 0.1 milligrams. You may then hear or feel a click. 1 tick mark equals 0.1 milligrams in the dose counter. Hold the pen with the needle pointing up. Press and hold the dose button until the dose counter returns to 0. The 0 must line up with the dose pointer. Check that a drop of Norditropin appears at the needle tip. If no Norditropin appears, repeat the flow check up to 6 times. If there is still no Norditropin, change the needle and check the flow once more. Don't use the pen if Norditropin still does not appear. Contact Novo Nordisk at 1-888-668-6444. Step 3, select your dose. Now it's time for you to select your dose. To start, check that the dose counter is set at 0. Turn the dose selector to select the dose you need. If there is not enough Norditropin left to select a full dose, go to the frequently asked questions. Now, try turning the dose selector a few more times to get a feel of how it works. The dose counter shows the dose in milligrams. Use the dose counter to ensure exact dose selection. Don't count the pen clicks. Do not use the pen scale. If you select the wrong dose, you can turn the dose selector forward or backward to correct the dose. The pen sounds and feels differently when the dose selector is turned forward, backward, or if you accidentally force it past the number of milligrams left. When you have selected the dose you need, you're ready to make your injection. Step 4, inject your dose. Norditropin can be injected under the skin subcutaneously of your hips, stomach area, abdomen, buttocks, upper legs, thighs, upper arms, or as otherwise instructed by your healthcare provider. Make sure you change the injection site every day. Once you feel ready, insert the needle into your skin as your healthcare professional has shown you. Make sure you can see the dose counter. Don't cover it with your fingers. This could interrupt the injection. Press and hold down the dose button until the dose counter shows 0. The 0 must line up with the dose pointer. You may then hear or feel a click. Keep the needle in your skin after the dose counter has returned to the 0 and count slowly to 6. 1, 2, 3, 4, 5, 6. Now remove the needle from your skin. If blood appears at the injection site, press lightly. Don't rub the area. You may see a drop of norditropin at the needle tip after injecting. This is normal and doesn't affect your dose. Step 5, after your injection. Carefully remove the needle from the pen. Don't put the needle caps back on to avoid needle sticks. Remember to place the needle in a sharps container immediately after use. Always remove the needle from your pen. This reduces the risk of contamination, infection, leakage of growth hormone, and blocked needles leading to inaccurate dosing. Do not try to put the needle cap back on. You may stick yourself with the needle. Put the pen cap on your pen after each use to protect the norditropin from direct light. Always dispose of the needle after each injection. Put the needle and any empty or discarded pens still containing norditropin in a sharps container. If there is enough norditropin remaining in the pen for additional use, you can either store your pen outside the refrigerator up to 77 degrees Fahrenheit for use within 3 weeks, or in the refrigerator between 36 and 46 degrees Fahrenheit for use within 4 weeks. As a reminder, all unused pens must be refrigerated between 36 and 46 degrees Fahrenheit prior to first use. Do not freeze and avoid direct sunlight. So that's how you use your pen. For additional information, you can refer to the instructions for use included in the packaging with your Norditropin Flex Pro pen or the frequently asked questions section of this video. Frequently asked questions. In the following, you can find answers to different questions that might typically come up. How do you see how much norditropin is left in your pen? What if you need a larger dose than what is left in your pen? What if no norditropin appears when you check the flow? What if 0 does not appear after completing your injection? How should you handle your pen? What if you drop your pen? How do you clean your pen? How do you dispose of needles and pens? How do you see how much norditropin is left in your pen? The pen scale shows you approximately how much norditropin is left in your pen. To see exactly how much norditropin is left, use the dose counter. Turn the dose selector until the dose counter stops. If it shows a maximum dose of 8 milligrams, at least 8 milligrams are left in your pen. If it shows, for instance, 3.8, only 3.8 milligrams are left in your pen. What if you need a larger dose than what is left in your pen? It's not possible to select a larger dose than the amount of milligrams left in your pen. If you need more norditropin than you have left in your pen, you can use a new pen or split your dose between your current pen and a new pen. Only if trained or advised by your healthcare professional may you split your dose. Use a calculator to plan the doses as instructed by your healthcare professional. Be very careful to calculate correctly. If you're not sure how to split your dose using the pen, then select and inject the dose you need with a new pen. What if no norditropin appears when you check the flow? There could be two reasons why no norditropin appears at the needle tip. First, your needle may be blocked or damaged. Remove the needle and check the flow again with a new needle. Or, if norditropin still does not appear after changing the needle, your pen may be defective. In this case, don't use the pen. Contact Novo Nordisk at 1-888-668-6444. What if zero does not appear after completing your injection? In this case, a needle may be blocked or damaged and you have not received any norditropin even though the dose counter has moved from the original dose that you have set. Remove the needle and check the norditropin flow again with a new needle. Select your dose and make your injection. How should you handle your pen? Be careful not to drop your pen or knock it against hard surfaces. Don't expose your pen to dust, dirt, liquid, or direct light. For further information on how to store your pen, see the patient information section in the instructions for use that came with the norditropin Flex Pro. What if you drop your pen? If you drop your pen or suspect a problem, attach a new needle and check the norditropin flow before you make an injection. Don't try to repair your pen or pull it apart. How do you clean your pen? Don't wash, soak, or lubricate your pen. If necessary, clean it with mild detergent on a moist cloth. How do you dispose of needles and pens? Always dispose of the needle after each injection. Put the needle and any empty or discarded pens still containing norditropin in a sharps container or some type of hard plastic or metal container with a screw top, such as a detergent bottle or empty coffee can. When the container is full, seal and dispose of it as described by your healthcare professional and local or state authorities. Don't dispose of used needles in your household trash or recycling bins. For more information about safe sharps disposal and for specific information about sharps disposal in the state that you live in, go to the FDA's website at www.fda.gov/safe sharps disposal. Important information. Caregivers must be very careful when handling needles to reduce the risk of needle sticks and cross-infection. Always keep your pen and needles out of reach of others, especially children. Norditropin Flex Pro 30 mg, 3 milliliter pen is not compatible with Flex Pro PenMate. If you have any other questions, please contact your healthcare provider or call Novo Nordisk at 1-888-668-6444. Thank you for watching this instructional video for the Norditropin Flex Pro 30 mg, 3 milliliter pen.